Most of our kids are back in the classroom right now, and for the first time in a few years, they are backed with relaxed COVID restrictions. The CDC is expected to do the same. So what do you have to do if your child gets sick? Julie Broughton is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
For the last few years, it has been one of the biggest questions parents face. Do I keep my child out of school if someone is sick? So Dr. Deron Lee, a family medicine physician with HCA Florida Healthcare, is here now to talk about the latest guidelines from the CDC. Good morning. Thank you for being here.
Thanks for having me. I'm excited.
Yeah, it's a big day. And of course, I feel like every time we start back to school, there's always a variety of illnesses. So just, before we even get to COVID specifically, what do parents need to know about that? My my sister is a teacher, and she feels like she's sick the first 6 weeks of every school year. What do we need to be thinking about as we head back into the classroom?
Well, we are still in the midst of a pandemic. The main thing to understand is if you feel sick, if you are concerned about symptoms, stay home and contact your healthcare provider.
Yeah, and I know a lot of times, especially years ago, people were like, oh, unless you have a fever, you have to go to school. Or is that guidance just different now since we are in a pandemic?
It is a little different, particularly with children. Children can have no symptoms, very few symptoms, or many severe symptoms.
Yeah.
So it's really kind of keeping an eye on any of the symptoms that are associated with COVID. Cough and fever are the two most common, but you can have fatigue, nausea, vomiting, diarrhea, abdominal pain, fatigue, loss of your sense of smell or taste, etc.
Yeah, and I know when the pandemic first started, if you had been anywhere near someone, the CDC guidance was that you did need to quarantine. The guidance has changed, so talk a little bit about that within the schools.
Well, there's some slight changes. However, the most important thing is if you test positive for COVID or experience symptoms, you should still quarantine for at least 5 days from the initial onset of those symptoms.
So if someone in my child's class tests positive for COVID and, I test my child, they don't have symptoms, maybe they're negative, what should the thinking be? Can they still go to school and be out, or even if you don't test them and they've been exposed?
If there is a confirmed exposure, you should still undergo the isolation and quarantine guidance as indicated by the CDC.
Okay. And, as this virus continues to mutate, do you have concerns going into the school year, or what have you been seeing in your practice?
Well, viruses do what viruses do. They do mutate. The most recent strain, the BA.5 subvariant of the Omicron strain, is particularly interesting because it's very transmissible and it has a quality of what we call immune evasion. So even those individuals that have antibodies to COVID-19, either from a prior infection or vaccination, are still at risk.
Well, we were just talking before we went on. It's so weird. I have a friend who's had it 3 times, and then people who haven't had it any time, and it's not that they're necessarily living their lives differently. I mean, it just seems like the strangest virus as we continue to discover.
It is, and it's ubiquitous. It's everywhere, and we are all susceptible to a potential COVID-19 infection. Of course, those individuals that have some underlying health conditions or who have issues with their immune system are particularly at increased risk.
And for parents who might be on the fence about vaccines, what advice would you give them when it comes to that?
Get vaccinated. That's our number one strategy to reduce the chance of getting COVID infection and reduce its transmission. So I implore everyone to get vaccinated as soon as possible.
Excellent. And, there are other viruses out there. I think every time someone coughs, you think, oh my goodness, I have COVID, but there's also been a lot of flu this summer as well. What would you say about preventing just all of this as we head back to school?
Absolutely. Flu is still rampant. Utilizing the same strategies that we employ against COVID-19. So frequent and thorough washing of your hands, wearing masks when it's appropriate, being smart about the choices of venues that you attend as well.
Yes, and lots of activities will be happening, parties, football games, things like that. What do we need to keep in mind as we're still trying to live our lives, but also keep ourselves and our loved ones safe?
Have fun, but be safe.
Yeah.
Again, employing the strategies that we know work. If we are unable to maintain a distance of 6 feet or approximately 2 meters, wear a mask. Avoid getting together in enclosed spaces that don't have good ventilation. But again, using common sense strategies as well.
At least with Florida, we can be outside just about year round.
Absolutely.
So that is a benefit. Well, thank you so much for joining us.
My pleasure.
It's been a pleasure to talk to you.